All right, there we go. All righty, welcome folks. We're just gonna let folks trickle in here and then we'll get started in a few seconds. Hope everyone's having a great afternoon, this beautiful day. Okay, we're going to go ahead and get started. I just want to say good afternoon. I'm glad we're all here today. I want to welcome you to our third Lunch and Learn session. We have 6 in a series called Disability Awareness. And these webinars would not be possible without the generous donation from Harvey E. Najam Charitable Foundation and the Mays Family Foundation. Just a few housekeeping basics. We're going to mute everybody's microphone and the video is going to be turned off for the webinar. So if you have any questions, please go ahead and put those in the Q&A. And at the end of the presentation, we will go over questions. The session is being recorded, so just please do not disclose any information that is private or personal, either in the chat feature. Following the presentation, we will send out a link for the session. So, feel free to share that and have that handy. So the session this afternoon is titled How Sexuality Shapes Individuals with Disabilities. And our speaker today is Dr. Steven Gonzalez. And Dr. Gonzalez and I go way back. He's been a wonderful partner here at the ARCA San Antonio. Dr. Gonzalez, he's currently licensed in the state of Texas as a doctoral level behavior analyst and holds a national board certification in applied behavior analysis. In addition, he successfully earned a professional certification from Florida State University in trauma and resilience and holds a certification as a certified clinical trauma professional from the International Association of Trauma Professionals. So Dr. Gonzalez acquired a certification in a dialectical behavioral therapy, and he has extensive training in the modality of acceptance and commitment therapy. He currently holds a certificate from the San Antonio College Law Enforcement Academy as a police academy instructor and police academy instructor certification from the Texas Commission Law Enforcement Officer Standards and Education. And there is a plethora of other wonderful, amazing things that Dr. Gonzalez has done. So visit his website, which I'm sure at the end of the presentation, he'll give you a way to contact him. And just one other thing I want to share is that Dr. Gonzalez currently serves as the owner and chief executive officer for the South Texas Behavioral Institute. So with that, I'll go ahead and turn over the presentation to you, Dr. Gonzalez.
Awesome. Thank you, Heather, and welcome everybody. I appreciate you spending some time with us today. And hopefully we did not put everyone to sleep with that introduction, but most appreciated. So today really is talking about how sexuality shapes individuals with disabilities. So the idea behind today's presentation really is to look holistically at the person. I know we talk a little bit about sexuality, and to be quite frank, some of us kind of shaking our boots when we think about our son or our daughter going through, the post-progressive age, and then, realizing that their bodies are going to change and what that's like. So I ask you to really think about how you learned about sexuality. I want you to go back and be reflective here for a second and think about how you learned about the euphemism of the birds and the bees. Well, if your experience was like mine, it was like this sign is all over the place with the good luck on the bottom. It was really kind of unsure what was right, what was wrong, who to ask questions to, who not to. I didn't know if I could ask my parents questions, my grandparents, or if it was best to ask my friends or just try to figure it out on myself. I ask you to think about this. I ask you to think about the fact that you have an opportunity with your son or your daughter to be not only a guide, but a mentor to them through the idea of what sexuality is throughout their life. Now, when people think about sexuality, most of us, think about the sense of, oh, the physicality that comes with it. And we're going to go into something that is actually much deeper than that and much more important. So some of us learn, the idea of birds and the bees. And if you kind of look at this little laptop pointer thing, it's kind of like that. Is this supposed to be a formal conversation? Is this informal? How do I create the connection? So in this example, somebody used the keyboard to talk about things such as somebody's breasts, the nipples, the clitoris, the penis, the anus. And all of these things may be uncomfortable for you to say or talk about. But I ask you to think this. Would you prefer to be the one to talk to your son or daughter about this and educate them? Or would you like to leave that to their elementary, middle, and high school friends to educate them? Take that as your walk away and think about that possibility. And when I think about my child, it makes me tremble in my boots to think that her peers would be her guide. So I ask you to think the same. One of the challenges that we see, however, within the community, just talking about sexuality, is when we add the word disability on top of it. And think about how many people see that in a different light than from what we do, because we live this particular world in which we're loving and supporting our individuals that have disabilities. And some go as far as even saying individuals with disabilities shouldn't be sexual at all. And what that doesn't allow us or them to understand is sexuality is way more than physical. So we'll talk about that today. And I wanted to resonate with you because I want you to take a deep understanding of what it is that we're attempting to build here. One of the largest issues facing individuals with disability today is the lack of sexual education. So we ask ourselves, why do we think that is? Well, why is there such a lack of sexual education? Well, if you think about it, in the public school system and even in private schools, sexuality is such a tough topic. And it's such a sensitive topic because it deals with some of the most intimate thoughts and ideas that we've ever been presented with. And because of that, it quite frankly scares us. When you compound somebody that has a disability on top of that, it scares individuals even more. But I want you to keep this in mind is fear and the inability to want to talk about this is nothing more than just allowing yourself to remember it's education. And do you want to be the guide? Do you want to be the mentor? Or do you want to leave that for somebody else to do that for your son or daughter? And I know I keep saying that because I want you to remember that. That is your walk away. That's what's important. So some of the general concerns that we hear among the population are our personal upbringing, societal, religious, normative, and personal values don't support discussing sexuality. I remember as a young man, it was never talked about in my grandparents' home or even in our home. Sexuality was just something that was off the table. It just was never, ever discussed. But I want you to think about mainstream media, and I want you to think about computer access and internet access today. Think about the commercials that we would see on TV in the 1960s, 50s, and 70s. And look at the difference between what you see then to what you see today. And probably some of the things we see on television and mainstream TV today would have been considered pornographic back in those periods. So again, the world is evolving, technology involves, transparency involves when it comes to sexuality. So we have to make sure that us as family members, as parents, as husbands, wives, partners, we are all integrated into what's happening now so we can be at the most supportive possible for our individual. We do not know where to start, what to say. So quite frequently when we're helping families go through this transition and help them understand the basics, they have to say, Dr. G, I don't understand. What do I tell them? Where do I even start? I'm honestly kind of scared to even say anything because perhaps they've never even brought it up. So if I say something, would it make them more curious? And if it makes them more curious, then does that put me in a position where I'm creating more harm than good? Remember, sexuality is significantly more than just the physical component in the act. Our child has never expressed an interest in sexuality, so we're not even going to put this on the table because we're not concerned. If they have no interest, we're not even going to broach the topic because it's obviously not important. So we would prefer not even having a discussion if it's not necessary. Our particular son or daughter can't cognitively understand the concept of sexuality and what is appropriate versus inappropriate. So how do we even broach the idea of starting there? Well, something to think about is some facts is that people with intellectual disabilities generally have the same range of sexual thoughts, attitudes, feelings, desires, and fantasies as people without. The body, the physical body, the biology of the person is not different from those that are considered quote unquote neurotypical. They have the desires, they have the physical needs, they have the physical thoughts, and the attitude towards sexuality. Most children with a developmental disability begin puberty at the same age as other children and experience the same physical hormonal changes. So again, the physical body itself is distinctively different from the ability to cognize the idea of what sexuality is and what sexuality is not. Now, it has been shown in studies that individuals with neurodevelopmental disabilities are 20 times more likely to experience early pubertal changes. So you'll see that again. We need to really think about when age plays a factor and a role and the developmental milestones that our individuals hitting, look at the components and break them apart. And what do I mean by that? Look at the physical body of your son or daughter and ask yourself, where are they physically? And then look at the cognitive abilities available to them and ask, where are they cognitively? And create some sort of a median to understand the cognitive abilities may not be the same as the physical abilities. However, the physical necessities, requirements, needs, and desires are still there. And the cognitive abilities may still be there with the attempt of trying to understand what sexuality is. The biggest thing to consider is this, is we can, and sometimes are afraid as parents, as supportive, as foster parents, as grandparents, as individuals supporting this individual. We have to be okay with exploring this area. Despite the similarities, an individual with a developmental disability will likely need more education and support to understand and manage these thoughts, feelings, desires, and physical changes. So what's interesting is today sexuality is something that we continue to explore as adults, regardless of intellectual disability or not. We explore it every single day. We explore what sexuality is. And this is one of the most profound slides, I think. And this was by the U.S. Sex Information Educational Council. And it says, human sexuality encompasses the sexual knowledge, beliefs, attitudes, values, and behaviors of individuals. notice it's way more than the physicality. Now, it does say, yes, it deals with the anatomy, physiology, and biochemistry and the response systems, but it's also super important that we understand that it identifies with roles, personality, individual thoughts, feelings, behaviors, and relationships. It addresses the ethical, spiritual, and moral concerns in group and cultural variations. So let's pause here for a second and think about this. Sexuality is about the holistic person. It's about the relationships with mom and dad. Sexuality is about the relationships our son or daughter see mom and dad having, dad and dad, mom and mom. It's about the relationships they see their peers having. It's about the relationships that they see things on television taking place. It's about acceptance of social reciprocity in groups and lack of acceptance. It's also about rejection. Stop and think for a second and be honest with yourself here. Do you remember when you had interest in someone at some point in your life, whether it was elementary school, whether it was middle school, whether it was high school, whether it was yesterday, college, and you decided to take a risk and let that person know that you were interested? And you did, and you were rejected. You said, no, I have no interest in you, I'm sorry. Ask yourself, how did that affect your personal self-reflection? How did that affect your ability to go up to somebody else? How did that affect your thoughts, your feelings, your behaviors, and your future relationships? Ladies and gentlemen, that is sexuality. That is the true essence of sexual education. So it's significantly bigger than just one dimension. It's multidimensional. So we're looking at gender role socialization, physical maturation, body image, self-esteem. Think about how many of us have tried to lose weight for years. And ask yourself, was I doing it for medical concerns? Or was I doing it because I wanted to feel different about myself? That's sexuality, social acceptance. Think about social relationships, being liked and accepted, displaying and receiving affection. Future social aspirations. It's as simple as what happens, as much as we don't think it does, what happens in a work interview. How does our son or daughter understand the difference between a friend that's a boy and a boy that's a friend and a boyfriend? How is that explained? See, so again, it's significantly more than just hormones and reproduction. It's about the entirety of the person. What are some of the benefits of sexual education? Well, we're looking at social interaction and skill development. We're looking at things like improved feelings, attitude, values, and self-esteem. Greater independence. After all, think about it. One of the most important things that we are constantly looking to do is have our son or daughter have the most independent, successful, self-fulfilling, happy life. That's our end game. That's all we want. We want them to be protected. We want them to be safe, but we want them to have as much of a good life as we can possibly give, and they can possibly take on their own. But we also want to educate them so they have the reduced risk of pregnancy, of abuse, of STDs. Do you know physical abuse, neglect, is higher within the IDD population than any other population? Think about that. We want to provide them the opportunity to report abuse in a successful manner. Healthier choices in sexual behavior and relationships, and also know the difference between appropriate versus inappropriate sexual behaviors. What is considered healthy sexuality? Is it okay to use the correct language to identify the body parts, or do we create, if you will, euphemistic names for these body parts, which can be dangerous? An example I can give you is a child that I once knew of an incident that took place where the child loved to eat bonbon ice creams. Well, bonbon ice creams come in pairs of two. So the parents decided to name her breast bonbons. Unfortunately, this child was inappropriately touched by someone. And when the police department came to visit and understand what had happened, she said her bonbons were touched. The difficulty with that is the child was eating bonbons. So the identification of her chest and her ice cream were the same, which created difficulty for how that case was prosecuted. That's an example of clarity and why the benefits of transparency and how we do sexual education is so important. So some of the risks that we possibly have in avoiding is sexually transmitted diseases, pregnancy, victimization. Now, the reason is you see that individuals with developmental disabilities in traditional families may say, well, this is really something hard to take on. I'm not sure how to do it. So there's that lack of knowledge about sexuality themselves. How do I talk about it with my son or daughter? I don't even talk about it. My husband and I, my wife and I, my husband, wife, my partner, we don't even talk about it. So how do we even go about that? I want you to think about all the misinformation that's out on the internet today about any topic, any subject. One of the biggest ones is sexuality and sex. And think about how much access our son or daughters have today to information on the internet. Misplaced trust in others due to dependence on others for assistance, a tendency to be over compliant, and overprotection and limited social contact. Now, I'm not going to take them out. I'm not going to expose them. I'm going to ensure their safety, and then the lack of strategies to protect themselves. This is always a hard statement that I make in any seminar, regardless of whether it's sexuality or something else. But, mom and dad, I want you to think about this for a second. There's going to come a point in life where there's a possibility that we aren't going to be around anymore, and our son or daughter probably will be. Ask yourself today, if that happened to me today, have I done everything in my power to teach them to protect themselves? And if the answer is no, then I ask you to go on a journey with your son and your daughter and your family and do everything that you can starting today to create that synergistic idea of teaching them how to ensure their independence as much as possible and teach them protective capacities. Because I promise you this, no one will take care of them the way mom and dad does. No one will. And that's a scary thought, but that's also who I am. I'm a realist, so I have to be real with you and share that with you so you understand that that's the potential of what we have to do within the future. So an important fact is education about sexuality should be ongoing and tailored to the age and the ability of the individual throughout their life. So this is something that happens long-term. It's not a one-time talk. It's not a one-time experience. This is something that you will be a guide with them for the rest of their lives, in the hopes that they will someday maybe be a guide for their family. So the question always asked, well, is there a right way or the wrong way? Is there a good thing to do or not a good thing to do? And I want you to remember this, there is no right way to teach a child or even an adult about sexuality. It's a process that will involve success and will also involve failure. It's no different than taking a mathematics exam. I happened to fail a few in my lifetime, and I knew I had to take them over again. Teaching about sexuality, we're not going to always get it right, but the great news is this. If you create an open dialogue and an open door policy, if you will, or an open door culture with your son or daughter, they will come to you and you have that opportunity to reset and work at it again together. Here's a visual perspective I want to give you. Imagine there's a door in front of you, and your son or daughter is on the other side of the door, and you are on the other side. Today, you have the opportunity to open that door and keep it open and have a dialogue about sexuality, about the topics you choose. However, if you close that door in that discussion, in case you don't know this, the deadbolt with the key is on their side, not yours. And once they lock you out, it's going to be almost impossible to get back in. So keep that in mind. Always keep that door open, because once it's locked, it's really, really hard to get into and create that synergy again. So how do we teach sexuality then? Well, we're looking at two things. Number one, we're looking at developmentally appropriate books together. You may have a son or daughter that is 16 years old, but developmentally they may be 8. So we're looking for materials that are within the construct of understanding of an 8-year-old, or within the construct of understanding wherever your child may be, or your adult. We have to be strategic in how we do this. So we have to use pictures. We have to do demonstrations with dolls when appropriate. You're going to have those questions. Mom, where do babies come from? You're going to have those topics to come forward. Using proper terms as much as possible. Being transparent about sexuality. And again, remember, sexuality is way more than just the physical part. It's also about explaining why somebody feels sad, what it feels to hurt, why somebody's crying. Think about it. People cry because they're happy, but people also cry because they're sad. That can be confusing. And teaching the proper names for the body parts, we have to ensure that. Now, some of the things we have to keep in mind, though, is as we teach these things, and I'm going to give you some resources here that I have zero connection to, but I found over the last couple of decades doing this on places you can go to get some information. But learning may happen at a slower rate, so it's important to remember that and be patient with that. It may be difficult to comprehend some of the concepts of sexuality. But just because there's difficulty doesn't mean that you have to stop. We continue going and continue going. You never lose weight the first day you decide to lose weight. It's a process. There's limited literary skills. Abstract thinking may be difficult, and understanding information related to them, they maybe have not had that own life experience. This is where you become the mentor. This is where you are looked upon as the leader. This is the person I go to, because that door stays open. Now, I know one of the questions asked or being thought of right now is, what do we do if the doors are already closed? And we'll talk about that. But keep this in mind. Being positive about how you discuss and how you interact when it comes to sexuality is the key. Being open is the key. If we're punitive, if we're punishing, it's just like the basics of behavior management. If you're punitive and punishing, you know what's going to happen. You're going to get shut out. Here's something that I think is really cool. Make sure you know what you're talking about. Check the facts. We all know our children are significantly smarter than we give them credit or than others give them credit. And they are masters at understanding their environment and what's happening and what's going on. I promise you, if you don't check your facts, they may check you. So always check your facts. And Provide clear rules and guidelines upon what behaviors are okay and which ones are not okay. Adopt that from the perspective of your personal values, your norms, your cultural beliefs, your religious beliefs, your personal beliefs, your family traditions. That's the root to the question. Many questions are, what do we do in certain situations? And my answer generally starts with, well, let's talk about what your family values are. What is important to you as a family? What is important to you as a culture? What are important religious beliefs that you have? Because those all are variables that play significantly into how we approach teaching. And ladies and gentlemen, don't be too serious. As hard as that sounds, sexuality is a very beautiful thing that we as humans are allowed to experience. And that is love, that is intimacy, that is connection, that is understanding our environment and feeling good. And it also includes learning how it's okay to feel sad, learning how it's okay, how not to necessarily always be accepted, and learning how it's okay to fall, but to get up and walk again and not just stay there. So when do we teach? Throughout a person's life. Look for all the cues. Look for all the things that may give you insight. So for example, technology is a big thing today. So look at the search history on the computers, on the phone, on the internet. Look at the things that your son or daughter is involved in. Now, in the old days, we used to say things like, I'm going to age myself here. If you're looking at the newspapers and the Dillard's advertisement for underwear and bras is gone, that's a sign. I don't think they have newspapers anymore. At least I wonder now. When a child expresses interest or curiosity, again, television is full of sexuality. Even if you're just watching regular television, you're going to see a tremendous amount of sexuality in it. Before and during puberty and then post-puberty, look for the opportunities. Look for the moments of behavioral change. And what I mean by that is when you see somebody acting different, know that there's a component of something that's happened possibly and address it, explore it. So what do we actually want to teach here? Well, from the physical perspective is appropriate versus inappropriate expressions of sexuality. Public versus private body parts, puberty, personal care and hygiene, masturbation, mechanics of sex, reproduction, STDs, contraception, protective barriers, what that means, social skills, maintaining appropriate relationships, maintaining distance, the different types of relationships that exist, sexual relationships, marriage, same-sex attraction, relationship difficulties and rejection, and then individuals' values and how religious beliefs come into play. These are all the things we're looking for. So again, it's way more than just the physical act. It's about the collective as a whole that defines who that person is. And we're not trying to change anyone. What we're trying to do is guide them. You're the one with the experience of life, and your job is to pass that on in the most safe way that you can to ensure they develop protective capacities. So if you see here on the small little cards or pictures here, if you go to www.sexualityandyou.ca, again, I have no affiliation or connection to this group. You can see these are some sample cards that are cards that you can use to probe questions, to present questions, to talk about body parts, when it's appropriate to wear a swimsuit, when it's not, where you should change. Things like masturbation, people say, well, I've taught my son or daughter that masturbation is okay and they can do it in the bathroom. So then I challenge mom with that and say, well, what if you're at the Walmart bathroom? Is that okay? And they're like, oh my gosh, I never thought about that. So what if you're in the school bathroom? So again, I want you to be methodical in how you process this. Do point to pictures, match them. Ensure that they truly know the names of their body parts. These are systems of protective capacity. If you go on the internet and you type in Baxley and Zendel 2005, they are two particular authors that have a lot of publication materials specifically to teaching sexuality. Again, I have no connection to them. However, they are a really good resource that provides you with information that you can use. Private versus public behaviors. Again, going back to these cards that you can find. And the neat thing is with today's technology, you can actually create these cards at home for yourself, specific to your particular environment and what's happening in your environment. Again, it's just about being creative in how you approach it. Baxley and Zendel had this really cool worksheet. It's called Public versus Private. And this is just a snapshot. It goes significantly longer than this, but this can be a guide for you as well. And it says discuss the house rules and regarding dress, house rules regarding touch, house rules regarding private areas. Discuss where public places are in our home, neighborhood, communities, and school, public versus private and everyday activities, and trusted individuals, personal feelings, issues, and needs. And it breaks it apart for you. And again, this is free, so go out there and look for it. And it's going to give you talking points. And once you start having these discussions, it's going to open up an opportunity for you to really explore where your son or daughter is when it comes to sexuality, how they're developing, not only physically, but from a cognitive standpoint, and in some cases, culturally, religiously, and even spiritually, which those are the discussions that are beautiful, because those are the things that they will remember, and so will you for the rest of your life. But it's an opportunity for you to connect and share knowledge, share your wisdom, the wisdom that you've received that you know will help them develop protective capacities. So from a relationship standpoint, discuss appropriate affection. Who is it appropriate to have affection with whom, and with where? Social norms, it allows you to model social norms. When does somebody hug? And what is hugging like? And do you just hug people for no reason, or are there specific reasons? And, you know, Dr. G, what do I do? My son is physically 17 years old. His cognitive abilities are that of a 6-year-old, and he is automatically drawn to children 6 years old, but it looks different because he's 16 physically. How do I protect him? These are exploration things that you have to work through with your family and say, how do we create a sense of synergy so we know how to teach our son or daughter those protective capacities? And teach them the right to refuse. I don't want to be touched. I want my distance. Please stay away. Use contextual social situations as examples to guide them. Remember, do you want to be the teacher, or do you want their peers to be the teacher? Masturbation, this is a tough one for a lot of people. Self-touch and masturbation should be discussed as a neutral and healthy way to explore and express sexuality in a private place. Again, this is something you have to go back to your personal, cultural, religious values and ask yourself, is this something that we're going to explore with our son or daughter? And then you start looking for things like, wow, the shampoo's really going through quick in the bathroom. I don't understand why. We don't have our shampoo staying as long as it used to. Now it's super quick. These are tips. These are little insights and little flags that are popping up, and you have to look for them. These are things you want to look for to say, hey, let's talk about that. Let's keep this door open. Also, where it is appropriate and inappropriate to masturbate, where it is appropriate or inappropriate to hug somebody, when you can touch somebody, when you can't. And then this is always the really difficult when it comes to birth control and disease prevention. And I highly recommend you include your medical doctor, your medical professional into this dialogue. Include your clergy, your cultural family, what they want, your religion. All of these things have to be synergistic. You can't create something that isn't part of who you are and expect it to sustain long term. You have to be synergistic, and you have to make the right choices together with your son or daughter. Include them, please. If they can process what you're attempting to explore, include them. It's part of the equation. Long-term consequences of pregnancy and STDs. Think about that. If somebody ejaculates or somebody has an orgasm, that temporary euphoria of dopamine that goes through their body and their body feels that euphoric state, that's temporary. Do they understand the long-term consequences of pregnancy and what that could mean? Talk to your doctors about barrier devices, about birth control, what that means and how that would affect your son or daughter. Explore that. Medications, prolonged use of injectable contraceptives. And then this last bullet point is a tough one, but I included because I do get questions on it. What about sterilization? And again, I ask you, if you're considering that, come as a collective. Include your son or daughter in that. Include their personal needs as well. And make that decision along with your medical doctor, with your clergy, with your parents. Include them as a collective. So when do we know that sexual behavior can potentially be problematic? When should we start saying, okay, we might need some help here? Well, first of all, it's important for us as the adults to be self-reflective and ask ourselves, what is considered normal versus abnormal sexual behavior? Now, we know that our son or daughter that may have a developmental disability may have some challenges understanding that because of maturity, because of age, because of physicality or cognitive abilities. But it's important for us to understand ourselves what we consider to be abnormal and take kind of a baseline of that. For example, we know that some normal behavior, sexual behavior in children are asking questions about their body, asking questions about reproduction or how children are born, birth, arousal, having erections, questions about marriage and intercourse, exploring different gender roles, playing with toys versus playing with dolls. Gender, are opposites. These are explorations, looking at their bodies and their bodies of others. We know that it's pretty common for 5 to 6-year-olds to look at each other's body parts, touching genitals and exploring anatomy and sensations, engaging in mutual touching with similar age friends, same or opposite sex, all considered normal characteristics of sexual exploration, sexuality. You see these behaviors begin to be acting out with dogs, with pets, with dolls, stuffed animals in the context of play. And then you hear inappropriate jokes being shared with peers and sometimes attempted even with you just to see what your reaction is to it. Then it progresses. Now we're looking at romantic interests in early adolescence, dating, the curiosity, sexual fantasies. Again, the biology of the person does not preclude that they cannot have sexual specific interests or sexual specific fantasies. And physicality sexually may begin in early adolescence. Right now, statistically speaking, they say that approximately 50% of all high school age youth are actually sexually active. Now, I know that probably most of you fell out of your chairs when you read that. But that's the reality of what our world is today, so we have to ensure that we're prepared for it. Now, what are some flags, problematic flags to look for? When you start hearing others complain about, I don't like him touching me all the time, he's always touching me. When you begin to see sexuality begin to interfere with social and family relationships and normal or daily functioning, this is a physical part. When things are out of balance, so the child is masturbating 3-4 hours a day, doesn't want to eat, doesn't want to get involved, is focused on that. You've asked them to stop, and in spite of asking them, they continue to do so. So they ignore your requests. And now we're seeing this begin to generalize, and it's happening in inappropriate places in public. even though you know that they've been educated that those things are not considered safe places or appropriate places to do it. The individual appears unable to stop now, and we're seeing a sense of, acceleration in the behavior. In some cases, sexuality accompanied with aggression or verbal expressions of anger when you ask them to stop, or when you interrupt them, they get physically angry with you. You start noticing fear, anxiety, shame in these types of associated behaviors. These are when you start beginning to kind of ask yourself, okay, is this different? Is this something that I should speak with someone about? And again, when you're looking at behaviors that cause physical or emotional pain or discomfort to others or to themselves, sexual behavior towards much younger children, forcing others into acts, and tricking or bribing others into acts. These are when we're looking at some serious problematic behaviors. And that's when you actually want to go and begin to look for support from a professional. So problematic sexual behaviors in individuals' development may also be related to not understanding boundaries or poor social skills, the lack of impulse control, repetitive perceptive behaviors that are connected to that. Lack of opportunity for social and romantic relationships. Remember, they have that need and those desires. And then, of course, having the difficulty of understanding abstract concepts. This slide is why we need to continue to teach throughout life. It's not a one discussion and done. It's a life process. It's a journey. It's a journey of guidance. So what do? Okay. Acknowledge the behavior. Remember, keep that door open. Keep it open. Don't be punitive. Keep it open and say, hey, I notice you're touching your penis and it probably feels good. Let's make sure that we're doing this in a safe place where you're protected, okay? And provide that support and that guidance. Discuss the rules of the behavior and you set those boundaries. Keep this in mind. If you set the boundaries and you set some rules and you're consistently morphing and changing those rules, your son or daughter is going to very quickly ascertain that you are not consistent. And your lack of consistency is interpreted as freedom. Think about that. Some people say that they use punishments for when and where things should and should not happen. I personally don't recommend them. I recommend use reward systems. And what I mean by that is this: we know clinically and through thousands and thousands of studies over the last 60 years that punishment is something that temporarily fixes a problem, but the likelihood of it returning is extremely high. The reward system actually shapes a new behavior and allows you to develop a new frame of reference, and it builds a repertoire versus punishment where it removes the repertoire. So think about that as well. And then think about safety issues. Where's the behavior occurring? Do we need others to be the end of the problem? Who can I get involved to assist? Do we need additional supervision? Are children or others in the home safe? How do we actually ensure that these things are looked at and addressed when it comes to the education part? Remember, when behaviors do not decrease or become increasingly problematic or abusive or harmful, get professional help, get professional support and guidance. Get an assessment to see what's actually happening. What are some of the contingencies here? Is it a mental health issue? Is it a behavioral health issue? Start beginning to explore that as quickly as you can to ensure that they're safe and protected, as well as others are safe and protected as well. I hope you have at least a baseline of information today from that. And I want to thank you for your time today. I hope you take this information and start your journey. And just remember, it's a journey of exploration together. There are no right or wrongs, but it's just a cool journey that you get to be the guide on. And please don't let your son or daughter use their friends as the guide. Make sure it's you. Thank you guys for your time.
Thank you, Dr. Gonzalez. This has been amazing information. Just a reminder, if anyone has any questions, please feel free to put those in the Q&A. We did have a question, Dr. Gonzalez. One of the participants asked if you would mind sharing the PowerPoint. So if
Absolutely.
you're okay with that, then we'll send that out to participants.
Of course.
Also, one of the participants was looking at the website that you had referenced with the cards.
Yes.
And they were having a hard time finding it. So maybe you and I can work together to figure out where those cards are on the website, and then we can send that out as a follow-up.
Absolutely happy to do so.
Okay. So we don't have any other questions. I guess you answered everybody's question. Okay. So you're awesome, as usual. So I just want to thank Dr. Gonzalez for sharing his time with us today. Always a great partner with the ARC of San Antonio. Just a reminder that we'll send you then again the link for this session and also the PowerPoint. We just want to thank the Harvey E. Najam Charitable Foundation and the Mays Family Foundation for making these webinars possible. The next session that we have coming up won't be till next year, so just keep an eye out for that. It'll be in February. And the session will be developing self-determination skills. And that'll be presented by it'll be presented by Sam Gonzalez with Region 20. So we're excited about that. So with that being said, thank you all for joining us today. And we hope that you come to our next webinar. All right, so we'll let you go. Everyone have a wonderful afternoon and weekend.
Take care, everyone.
Right.
Bye-bye.
Take care. Bye. Thank you, Dr. G.
All right, Heather, good to see you as always.
All right, you too. You have a great Thanksgiving.
You do the same. Take care. Talk soon.
Take care. Bye.
Bye-bye.